Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent rib pain yourself. Firmly press the middle finger on a painful spot between two ribs, cover it with the palm of your other hand, then slowly slide your hands back and forth a dozen times, adding pressure as the tissues warm up. Repeat the procedure on any other painful spots you may have. Do this 3 times a day. These are the intercostal muscles. If it hurts yet feels good at the same time, you're doing the right thing. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If your pain is less intense and it's easier to breathe, it's proof that you're healing and you should congratulate yourself. If you treat yourself as I've described, you should be completely healed in 1 to 3 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. Never apply heat, including hot baths, since heat increases inflammation. If you've just hurt yourself, you may apply ice for 15 minutes 4 times a day for 3 days in order to reduce the inflammation. In order to accelerate healing, avoid excessive twisting and tight bra straps, or change to an athletic-style bra. Always bend your head down when coughing and sneezing. Once healed, if ever you feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of rib pain, if you heal yourself using my method, it's scientific proof that your rib pain was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, fibromyalgia, osteoporosis, spinal stenosis, scoliosis, misaligned vertebrae, subluxations, pinched nerves, a short leg or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of rib pain is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. Since left side rib pain can mimic the pain of a heart attack, if you're not sure of yourself, get to a hospital immediately. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now and happy healing.